My PhD topic is the assessment of efficacy and safety of natural products in the evidence-based medicine. My name is Dorottya Bastidas-Gergő. I am a medical biotechnologist and currently a PhD student in the Department of Pharmacognosy. My vision is that the evidence-based use of herbal products will be more widespread in the medical practice, and to achieve my vision, my mission is to provide scientific evidence for health professionals to facilitate their work and their evidence-based decision-making when applying herbal products. I have two ongoing projects. The first is the investigation of efficacy of peppermint on nausea and vomiting, and the second is the efficacy of Elixirium thymicompositum in acute bronchitis. The first project is a systematic review meta-analysis, assessment of efficacy and safety of peppermint on nausea and vomiting. Nausea and vomiting are common symptoms, but they can lead to severe consequences, and it can be experienced by several reasons, such as due to chemotherapy, postoperatively, or during pregnancy. The symptoms affect 40 to 80% of the chemotherapy patients. It is the major cause of patient dissatisfaction and can endanger the patient compliance. There are around 25 million surgery patients every year, and 1/3 of them experience nausea and vomiting, which can be even up to 70 to 80% among high-risk patients. It can lead to decreased quality of life and increased rate of complications. And worldwide, around 70 to 80% of the women experience nausea and vomiting during pregnancy. In the more severe symptoms, we could talk about hyperemesis gravidarum, which can also affect the baby's health and can result in, for example, low birth weight. And the current pharmaceutical products in the market are not always effective, and they can come with unpleasant side effects. Also, for example, during pregnancy, there is a very limited amount of products which can be used due to safety concerns. So there is a necessity for an alternative tool, and aromatherapy can be a good option, as it is considered as a mild therapy without severe side effects. And for example, peppermint oil is used in the traditional medicine to reduce the symptoms of the nausea and vomiting. So our aim is to examine the efficacy of peppermint on nausea and vomiting symptoms compared to placebo. Here is our PICO. We would like to use the population as adult patients experiencing nausea and vomiting symptoms in 3 subgroups: postoperatively, due to chemotherapy, and during pregnancy. The intervention was peppermint inhalation. The comparator is placebo, and the primary outcome is efficacy evaluated by the changes in severity of nausea measured by different measurement tools. We conducted our systematic search in November in 5 databases, and you can see here the number of the hits and the final search key. We found more than 1,500 articles, and after the full text selection, 16 articles were eligible. In the clinical studies, as I mentioned, they used different measurement tools and also different measurement scales. So for an analysis, we used the standardized mean difference. In general, then 0 score means if the patient does not have any nausea and vomiting symptoms, and as they have higher scores, it means that they have more severe symptoms. In the case of postoperative patients, they got peppermint oral placebo inhalation for 10 minutes, and their severity score was evaluated at baseline and 10 minutes after the intervention. We can't talk about the true value of the heterogeneity in this case. It is because of the different scales of the measurement tools. But concerning the efficacy of peppermint inhalation in 10 minutes, there is a 0.62 decrease in the nausea severity score. In this case, actually, the postoperative patients, you can imagine, was that way, that when they reported their symptoms, in that case, they entered the study and participated in this 10 minutes follow-up. And you can see that there is a statistically significant difference between the peppermint and the placebo group. Also, because we analyzed different measurement score systems, here you can see in this table more the effect change by percentage. Let's consider that the efficacy, the nausea and vomiting score at the baseline is 100%. So you can see that in the peppermint group, there is a larger decrease about the severity score than in the placebo group. In the case of the pregnant patients, the pregnant women got daily peppermint or placebo inhalation, and they had to evaluate their symptom score in some days, let's say that. And because of the limited amount of articles, we could only just find one time point, one follow-up time, which was at 4 days, where we could compare at least 3 articles. In this case, again, we can talk about the true value of the heterogeneity for the same reason as in the previous, that they used different measurement tools. But concerning the inhalation, the efficacy of the inhalation of the peppermint, there is a 0.37 decrease in the nausea severity score. And also, there is a statistically significant difference between the peppermint and the placebo group. Also, here you can see the effect change by the percentages. In the case of the pregnant women, we experience even a higher decrease in the peppermint group compared to the placebo than in the postoperative group. Our project has strengths. It offers a comprehensive and systematic review highlighting the use of peppermint oil for nausea and vomiting. But the limitations are that there were a limited number of clinical trials which used different measurement tools and included low patient number. The conclusions are that in the case of the postoperative patients after 10 minutes, they experience almost no decrease in the severity, but in the case of the pregnant women after 4 days therapy, there was a larger decrease in the severity. So, with peppermint inhalation, pregnant women might need less antiemetic treatment to reduce the symptoms. About the implication for practice, peppermint inhalation may offer a safe and effective alternative treatment to decrease the severity of symptoms and also to improve the quality of life. And the implications for the research is that further studies are needed with larger patient population and multiple follow-up durations, and also future studies could explore the optimal dosage, frequency, and duration of peppermint inhalation. So this is the progress of our first project. We are about the manuscript writing, and it is ready for sending for internal review. And the second project is a protocol for randomized clinical trial, efficacy of Elixirium timicompositum in acute bronchitis. Acute bronchitis is an inflammation of the large airways of the lung, and although the majority of the cases it is caused by viruses, but unfortunately there is a high antibiotic overprescription rate for the patients diagnosed with the disease. And there is a need for an efficient over-the-counter product to reduce the symptoms of the disease, and Elixirium timicompositum might be a good option for this. It is a Hungarian herbal medicinal plant which is used for decades for the treatment of inflammatory processes of the upper respiratory tract, and its active ingredient is thyme tincture. Our aim is to assess the clinical efficacy and safety of Elixirium timicompositum to ensure its safe and rational use and to reduce the inappropriate prescribing in treating the acute bronchitis. Here is our PICO. We would like to check 2 subgroups, adult and pediatric patients with acute bronchitis. The intervention is Elixirium timicompositum. The comparator is placebo. The primary outcome is efficacy evaluated by the bronchitis severity score. And the secondary outcomes are safety and tolerability and the necessity of antibiotic use. We had some meetings with the clinicians, and together we set up the eligibility criteria in details. So you can see here, mostly is children and adults with 5 to 12 bronchitis severity score they have to hold. That is the inclusion criteria. They have some concomitant medication like Tantum Verde. And the exclusion criteria are, for example, allergy to the active ingredients, to have chronic asthma or chronic bronchitis, lung cancer, or if some drugs were applied in the last 2 weeks or 1 month. About the second project, we are just at the beginning, so we just agreed on it that is feasible. So in summary, about the first project, then we are investigating the efficacy of peppermint on nausea and vomiting. We are in the manuscripting writing stage, and we will send it for internal review. And we would like to submit in April. And the second topic, about the efficacy of Elixirium timicompositum, we are just at the beginning, and after we finish the manuscript, we would like to start to focus on this project. So thank you for your attention.
Congratulations on your nice presentation. And I have a question regarding your first project. Can you please explain to me how they proceed during the placebo group? Because the mint has such an intensive smell, so I cannot imagine how the placebo group proceeded. Thank you.
Well, this is a very good question. I also checked, we were discussing about this. And well, let's start about the bad example. There was an article when they said that they only just put like food color in it, and they called it already placebo. But there is also a case when, for example, they put a very small drop into it, which should not have an effect, but should have some smell. Or sometimes they use that the mask, what they used for inhalation, it was before scented. So actually they can think like that. But also when we discussed about this, then, well, let's say that during the systematic review and meta-analysis, then, well, we can have our own comments on the projects, but it is written down that they officially considered it as a placebo, so we have to decide, or we have to accept that they like stated this.
Thank you for the presentation. Regarding the second topic about the Elixirium timicomposition, you mentioned its possible inflammatory properties in order to overcome the symptoms of bronchitis. Can't it be just the expectorant effect which is it used for, or does it have pathways which are known as anti-inflammatory or antibiotic other effects than an expectorant?
It's a good question. I didn't check yet about this because we are really just at the start of this. But thank you for the question. It is very nice to consider. So yet we are only just about to contact the clinicians. Obviously they know well the project, and I will check later your consideration. Thank you.